Hi, my name's Andy Alderson and I'm from Sheffield Hallam University. I'd like to talk to you today about a device that we're developing for laparoscopic or keyhole surgery based on auxetic materials technology. Auxetic materials are materials which expand when pulled or contract when pushed, and as this implies, they therefore undergo high volume change, and this is one of the features that we're looking to exploit in the device that we're developing. The number of papers that have been published on auxetic materials is increasing exponentially, and a number of patents have now been published by some major international companies, so it is a growing field of real technological relevance. In the UK, we are world leaders. 4 of the top 5 authors in the world publishing auxetic materials papers come from the UK. Laparoscopic surgery is well established now as a major operative technique. For example, there are 3 million abdominal surgery, keyhole surgery operations performed every year. This will increase because laparoscopic surgery reduces trauma to patients and increases the speed up of operation time, and therefore saving the healthcare costs. Currently, in order to access the surgical site, the surgeon has to create space in the abdomen. And this is done by essentially inflating the abdomen with carbon dioxide gas. This works in terms of creating space. It is not quite so useful or quite so successful in moving organs out of the way to allow the surgeon to operate successfully. There are a number of other complicating factors with the use of carbon dioxide gas. The increased abdominal pressure can lead to reduced function of the heart and lungs, for example, and there are a number of other medical conditions and post-operative pain conditions that can arise. There are issues with leakage of carbon dioxide due to the use of suction instruments and general leakage processes. It is difficult to use laser cutting or electrosurgical devices and so on. So there are a number of factors where we would like to replace carbon dioxide inflation. About 4 or 5 years ago, a surgeon from Central Manchester University Hospital's NHS Trust in Manchester developed a device called the Laparosphere. This is essentially an inflatable double-walled balloon, and the idea is that once it's gone through the keyhole, he inflates the balloon and he creates a hollow sphere, thus creating space and moving organs out of the way. The device that we're developing is an alternative expansion mechanism based on auxetic materials and structures. Okay. The role of the knowledge transfer network in this development, well, I've worked with the knowledge transfer network over a number of years now, and in fact I've been involved with around hosting or participating or speaking at around about 8 workshops, seminars and events for the KTN. And we are working hard to try and open up this emerging technology area for the benefit of the UK. Around about 4 years ago, we ran a workshop for auxetic materials in healthcare applications, where the partnership with Trustech, who are part of the Central Manchester NHS Trust, was brokered and developed. We were subsequently successful in securing an EPSRC Industrial Case Award allocated by the Materials KTN to take this development further. The impact of that is that there is now a committed team of academic researchers with expertise in auxetic materials and structures, working with a team of consultant surgeons and an NHS business development manager to take this development forward. There are 2 patent applications covering the auxetic device that we're developing. And the team has subsequently secured additional funding from the NHS and indeed internal university high funding to develop demonstrator expansion mechanisms, which we will then use to secure the next level of investment to take it towards commercialisation. More broadly, for the team at Sheffield Hallam, we are now working in a number of other healthcare application areas, and I'm working with another NHS trust and also with the commercial sector to develop these devices. The KTN has also helped stimulate activity in other UK research groups on auxetic materials. And one example is at the University of Bristol with my colleague and collaborator, Professor Fabrizio Scarpa, who is developing a treatment based on auxetic foams for multiple sclerosis sufferers. There are more details for that in the exhibition, along with the work that we're doing at Sheffield Hallam in the medical area. Thank you.